Everetts Law, the fight to end organ transplant discrimination. Southern Illinois University, MHA 575, Current Events in Healthcare. The date, January 23, 2021. My name is Vicki Brown. Objectives. In this presentation, I am going to give you a little bit of a background on the issue at hand. Organ transplant discrimination based on intellectual or developmental disability. I'm going to give you some basic information and statistics about transplants. You will learn about the background of existing federal legislation that is in place protecting against discrimination in the organ transplant process. You will also learn a little bit about the eligibility process and some of the ethical considerations at hand. Then, I am going to tell you the story of a little boy named Everett. I'm going to tell you about his parents' fight to help put a stop to organ transplant discrimination in Oklahoma. Currently, there are only 16 states that have legal protections against organ transplant discrimination. I'm also going to tell you about a couple other cases that have led to the creation of other states adopting legislation to prevent the discrimination. According to the Health Resources and Services Administration, in 2019, there were over 190,000 people, which includes men, women, and children, on the waiting list for organ transplants. That year, 39,718 transplants were performed. According to organdonor.gov, approximately 17 people die every day while waiting for a transplant. Approximately 95 transplants are performed every day in the United States. Data from the Health Resources and Services Administration also explains that a new potential organ recipient is added to the waiting list every 9 minutes. With such a short supply of organ donations, the screening process for a patient is often very rigorous. It must be objectively proven that a patient needs an organ transplant. There are 3 major pieces of federal legislation that were developed to help prevent organ transplant discrimination. The Rehabilitation Act of 1973, specifically Section 504, prohibits discrimination based on disability for any activities that are funded by the federal government. This law applies to health care due to Medicare and Medicaid funding. The Americans with Disabilities Act also prohibits discrimination based on disability and further states that individual considerations must be made. People with disabilities cannot be denied any programs or services just because of their disability. Finally, Section 1557 of the Patient Protection and Affordable Care Act bans discrimination based on race, ethnicity, age, sex, or disability for any services funded by the U.S. Department of Health and Human Services. Even though these pieces of legislation are in place on the federal side, not all states offer legislative protection against such discrimination. The National Down Syndrome Society reports that 85% of pediatric transplant centers take disability into consideration when deciding eligibility for an organ transplant. In fact, Richards, Crawley, and Magnus state that over half of pediatric patients with an intellectual or developmental disability never even receive an evaluation to determine eligibility just because of their disability. Some transplant centers will not allow patients with intellectual or developmental disabilities to even be put on a waiting list for a transplant. Because of this, some families have to take their case to the federal court system in order to receive the protections offered by federal law. Sometimes these battles can take years, and oftentimes these patients do not have years to wait. Some transplant centers base eligibility on quality of adjusted life scores, making the process more subjective and prone to one's beliefs over another. The argument has also been stated that people with disabilities are not considered for organ transplants because the provider doesn't feel that the patient has the ability to be compliant with post-transplant care. Some bioethicists have argued that organ transplant eligibility should be based on the greater good. What candidate would get the most benefit from the transplant? Someone without an intellectual or developmental disability, or one with? Others have argued that eligibility should be solely based on medical necessity, disregarding any disabilities completely. Now we get to my actual current event. This is the story of Everett. On a side note, the information regarding Everett was provided by Everett's mother, Neely Gay, to myself in a Facebook Instant Messenger interview. Neely Gay is actually from the town where I live, so I know her. Everett was born on July 4th, 2017, the second child to Riz and Neely Gay. Although all examinations and tests during pregnancy revealed a healthy baby, Everett was born with Down syndrome. Mrs. Gay stated that she received 3 ultrasounds during her pregnancy and none of them detected the disorder. This specific type of Down syndrome he has is called trisomy 21. This occurs when there is an extra chromosome in every cell of the body, and it currently affects approximately 5,000 babies born every year. That information according to the Children's Hospital of Pennsylvania. According to Everett's mother, Everett was born with an atrioventricular canal defect. This condition occurs when there is a hole between the heart's chambers, and it causes problems with the valves that regulate blood flow in the heart. Mrs. Gay said that this was by far the scariest part of it all, as he had open heart surgery after his first birthday. Since then, he has endured 4 other surgeries. According to Mrs. Gay, one of the most significant challenges for people with Down syndrome is low muscle tone. Low muscle tone affects their speech, gross and fine motor skills. Physical, occupational, and speech therapy can help with this. Everett's mother states that Everett has been in therapy since he was 4 weeks old. The Gays belong to a support group that is nationwide and provides support for parents living with a child of Down syndrome. It was through that group that the Gays learned that there was a possibility that if Everett ever needs an organ transplant, he can be denied just because of his Down syndrome. The Gays reside in Oklahoma, a state that currently has no legislation in place offering protection for individuals with intellectual or developmental disabilities in organ procurement. The Gays decided that they needed to reach out to their state senator to see if anything could be done. They sought out Senator Paul Rosino, and after hearing their story, Senator Rosino was more than willing to draft legislation. The Ponca City News Press reports that Senator Rosino was shocked to learn that this type of discrimination exists. Rosino drafted Senate Bill 378, otherwise known as Everetts Law. The law states that providers and organizations who perform organ transplant matching may not deny organ transplant based only on an individual's intellectual or physical disability. The bill also offers protection from health insurance by prohibiting insurance companies from denying coverage due to disability. Insurance carriers may not decrease reimbursement or incentivize providers to provide less adequate care. In an interview with Coco 5 News, Mr. Gay stated that it was heartbreaking that if his son were ever to need a transplant, he could be denied due to his disability. The legislation will be reviewed and voted on during the regular session of the Oklahoma Senate that resumes in February of 2021.
From his smile, spirit, and energy, you never know 3-year-old Everett Gay has been through as much as he has. Diagnosed with Down syndrome and a congenital heart defect shortly after birth, already having gone through 5 surgeries in his young life.
The thought that solely due to his diagnosis of Down syndrome, if he were to need a transplant, would get jumped in line by someone who didn't for no other reason than that is just heartbreaking.
Advocating on his son's behalf, Rees Gay reached out to Senator Paul Rosino for help. Rosino, vice chair of the Committee on Health and Human Services, eager to author Senate Bill 378, also known as Everetts Law.
The biggest thing about this whole piece of legislation is families that have someone that may have a disability, whether it's physical or intellectual, they can't be denied an organ transplant solely based on that disability. And currently in Oklahoma, they're not protected. And to me, that's shameful.
Rosino glad to champion the cause, leading the call for change.
That people with disabilities, they're not less of a family member. They're not less of a person in our society. And sometimes we need strong voices to stand up for them just because these people need voices.
Portia Riley, KOCO 5 News.
So now I'm going to talk to you about some other legislative protection against the discrimination of organ transplants based on disability. The first one I'm going to talk about is Charlotte Woodward Organ Transplant Discrimination Prevention Act. Charlotte Woodward was born with Down syndrome. Holohan interviewed Charlotte last fall after a TikTok video Charlotte did went viral. In the video, Charlotte talks about barriers that people with Down syndrome face throughout life, including getting subpar wages, the inability to marry or risk losing health insurance, and how individuals with Down syndrome are discriminated against for organ transplant. Charlotte herself was able to receive a heart transplant in 2012. She is a college student and she advocates against discrimination of people with disabilities through her work with the National Down Syndrome Society. In 2020, federal lawmakers drafted the Charlotte Woodward Organ Transplant Discrimination Prevention Act. The legislation's purpose is to prohibit discrimination for organ transplants based on disability and help strengthen the Americans with Disabilities Act of 1990. If passed, healthcare organizations would also have to ensure that their policies and procedures are accessible to people with disabilities. Looking at different state legislations, there are several different acts, but I chose to speak about 3. The first one is Sawyer's Law, and it is in Virginia. Virginia passed a state law in 2020 ending organ transplant discrimination. The law, called Sawyer's Law, was written by Senator Todd Pillion and was inspired by Sawyer Sheeler. In a television interview, Miller reports that Sawyer had to have heart surgery as an infant, which led his mother to wonder what would happen if he ever were to need a transplant. When she researched it, she discovered that he more than likely would be turned away for a transplant just based on his Down syndrome. Like the Gays, she reached out to her state legislature and got the legislation started. The law passed unanimously in 2020. Jackie Ward and her husband fought to end organ transplant discrimination in Ohio. Their daughter, Ellie, was born with Down syndrome. Miller explained that Mrs. Ward was told that Ellie would not be eligible for a transplant in the event that she needed one. At the time, Ellie was very ill due to her heart condition. She underwent 2 surgeries on her heart, but was able to avoid transplant. Representative Antoni introduced Ellie's Law to the Ohio General Assembly in 2017. The Wards appeared in front of the Assembly to advocate for the legislation to be passed. Paul's Law of Pennsylvania is named after Paul Corby and was written after Paul had been denied a heart transplant purely on the basis of his autism. According to Burling, Karen, Paul's mother, drafted a petition on change.org that received over 280,000 signatures advocating for an end to organ transplant discrimination. Representative John Sabatina introduced the bill in the legislature and in 2013, and it was passed in 2014. Because the discrimination typically takes place prior to the transplant center, it was almost impossible to find hard statistics on the exact number of discrimination cases there are. From everything that I read, the discrimination typically takes place at the starting point, and patients do not even get a referral to see a transplant center. The current states that have legislation in place include California, New Jersey, Maryland, Massachusetts, Oregon, Delaware, Kansas, Ohio, Pennsylvania, Washington, Louisiana, Indiana, Virginia, Iowa, Missouri, and Florida. The passage of legislation in these states ranges from 1996 to present. Hopefully, Everetts Law will be added in 2021 for Oklahoma. Putting an end to organ transplant discrimination is another step toward health equity in the United States. I was very shocked to learn that so many states do not currently have legislation in place to prevent such discrimination. I was also startled that although federal law should precede state, patients and families have to go to federal court in order to get the discrimination overturned. It was surprising to me just how severe the shortage is for organs nationwide. As a parent myself, I find it appalling that a child could be denied a life-saving organ transplant just because of an existing disability. This issue is one that could be debated on many different levels, and it is somewhat relatable to the ventilator shortage early on in the COVID pandemic, and the decisions that had to be made regarding what patient should receive the ventilator and who would take priority. It's a very ethical issue. I myself am a registered organ donor, and I hope that someday my life will lead to an improved life for someone else in the event of my death. Signing up for organ donation is possible at the Department of Motor Vehicle Services or by registering on organdonor.gov. Thank you for viewing my presentation. I hope it was as enlightening for you as it was for me.